to be recording this webinar, and it will be available on our Facebook page immediately after the webinar ends. It'll be available on our website a couple days after the webinar, so by the end of this week. We are also live streaming this on Facebook. I would encourage you who are participating on Facebook to use the chat box on Facebook if you have any questions. And if you have any questions during the webinar and you're participating via Zoom, please use the chat box or the question and answer box via Zoom. I'd like to thank Ben Jones from Disability Rights Maine and Atlee Reilly for Disability Rights Maine for joining us today. I know we all have a lot of questions about school reentry during this period of time, so I'm not going to delay. I'm going to turn it over to them and let them take it from here to get your questions answered and the information to you. So thank you very much, Ben and Atlee, and it's yours.
Great. Thanks very much. And I understand we've got a very full house. So I hope that, and for those who did this last time, I think Maine Parent Federation did an excellent job of kind of taking the questions from the chat and inserting them at appropriate times. And we will do our best to leave time at the end. My name's Atlee Reilly. I'm an attorney at Disability Rights Maine and handle education cases there. Ben will say more about it, but we released some guidance today that we'll put a link in the chat box to so that you can get that guidance. And this webinar is really to just kind of walk through that guidance, provide some opportunities to provide, do some question and answer. But just one thing I do want to stress is there are lots and lots of different plans going on all across the state. They're evolving, they're getting changed soon after they're released in some places. And so we're not going to be able to speak to each individual school situation, but hopefully we'll hit some broad themes that will be helpful as you advocate in your local districts. So again, Atlee Reilly, Disability Rights Maine, happy to be here. Ben?
Thanks, Atlee. So I'm Ben Jones, also an attorney at Disability Rights Maine, working on education cases. I'm going to kick us off and share the screen here. And just give me 2 seconds. Okay, is that a good view, Carrie and Atlee? Okay, great. So as Atlee said, we've released another guidance today, and this one's much more in depth than our previous 2, but we have done 2 earlier when the COVID disruption first occurred in March and April. We did them. So please go ahead to DRM's website. You can see those as well. And we'll post this guidance today. Actually, I think it was already posted, so that's live. This is our contact info. You can't go wrong by just going to Disability Rights Maine website, but here's our emails and our phone number. And throughout the presentation, there'll be moments where we say, this is a moment at which you might want to call us, but don't hesitate to call, complete an intake, see if it's a case we might be able to be involved in.
Ben, can you pause for a minute? I'm
Yes.
getting just word that they cannot see the interpreters, even though I've pinned them.
Okay.
It's strange. Let's see if I unpin and then. Pin video.
It's possible that the participants that need the interpreters might need to pin the interpreters themselves.
Okay, and I'm getting that I can see them. And yes, Dylan saying if you pin Kate on your individual screen, this may resolve the issue. Okay.
Okay.
Go ahead. Thank you.
For that. Yeah. Anybody, please jump in with any accessibility questions throughout, so we can make sure everybody benefits. So, all right. So that was our contact info. So this is just overview. Where are we now? So since March, Maine students with disabilities and their families have struggled with the impacts of COVID-19 on their education and everything else, really. Plans are coming out across the state, as Atlee said, and they're even changing on a day-by-day basis. This is the most important part we want to highlight, and we'll come back to throughout, but not a lot of federal, state, and guidance has come out, and so that's partially why a lot of people have questions. But the thing to know is that the rights that protect students with disabilities have not changed. So that's going to be a running theme. And this is our agenda. Really, the bulk of it's going to be number 1 here, which is walking through our recent guidance. And then we'll have some general slides on IDEA and some other laws. Really, if we get to it, I think we're going to have plenty of time just to spend on number 1. And number 3, Q&A and discussion. We're going to have that throughout, as Atlee and Carrie said at the beginning. Please chat in questions and we'll try to address them if they're relevant at the time. But don't hesitate to put them in because we might be able to address them at the end. So this recent guidance just today, we finished up and released. You can visit our website and get a copy of it. And it is an update to our previous guidances. Okay, so let's get to it. So as most people probably know, the state between the DHHS, CDC, and DOE have come up with this program, this category system, which is red, yellow, green, to determine their recommendation of a risk level to do with COVID-19. So red would be high risk for spread of COVID-19 and in-person instruction is not advisable. Yellow would be some elevated risk of COVID-19 and hybrid is one thing to consider. And then green is low risk of the spread of COVID-19 and schools can consider in-person instruction. So as you might have already seen, when they came out with the first colors on July 31st, and then they updated them last Friday, every county is all green. So that means, I'll just jump back. So that means that they're saying that there's a low risk and schools can consider doing full in-person instruction. That's going to look different everywhere, as we know. I think the most common thing we've seen so far is hybrid. And people might be able to chat in if they want to say what they're seeing in their area. So we get kind of a survey of what people are seeing. An important thing to note, and this is throughout a lot of DOE's guidance, is that things are recommendations and advisory. DHHS and CDC will not review specific plans. So there are times when DOE says explicitly, these are the health and safety requirements. Those are going to come up with the masks and the distancing and different physical plant recommendations, but a lot of the recommendations to do with the color system, it's going to be left up to the districts. So that's a local decision as to whether they open hybrid, in-person, or remote. So this is just a highlight of the categories of the safety measures that are required. So again, these are required. These aren't just recommended. And those categories include symptom screening, physical distancing in facilities, masks, face coverings, hand hygiene, protective equipment, and return to school after illness. There's more detail on all of these on DOE's framework website. That's within our guidance, but I think you'd be well on your way if you just Google DOE Maine framework. That'll get you there. So to do with hybrid and all remote models, which, as I said, that's the most common one we've seen so far, there are some minimum standards that the state has recommended. And we've divided them up into some categories that make it easier to read. But basically, instruction needs to be aligned with the MLR, which is the main learning results. There should be a daily schedule, live contact between teachers and students, direct instruction, independent student work, opportunity for questions and feedback during teacher office hours, continuing on access and student support as a category, materials and resources to support student engagement, identifying and addressing social, emotional, behavioral, and mental health concerns, and engagement. So tracking attendance each day, developing a plan to address lack of attendance and engagement, and a plan for regular ongoing assessment of student learning and engagement. So as I go through these, you're probably thinking, well, back in March, we didn't see this much in depth in our district, or, it's very possible. And so these are an effort by DOE to say, here's a framework, here's what hybrid and remote might look like.
Hey, Ben, I got a quick question for you.
Yep.
The Waterville School District is contracting out their remote learning. And so it's not being provided by school teachers, and students will not be able to fully or will not be able to be in classes with their peers. Is this allowed within special education for IEP recipients?
Yeah, and we're going to get more in depth on the differences of what's offered to all kids should be offered to every kid, and then there might be extra that is needed for kids with disabilities.
We'll address, sorry,
Yeah.
I was
Go ahead.
monitoring the chat, and we'll definitely address that water bill question. We won't have probably a clear answer. I think that question hits at, and it says it's water bills contracted out remote learning, not provided by school teachers, and parents are given the choice, and if they choose it, they'll be completely out of class with peers. Those types of things are going to present some of the trickiest situations, and so I'm going to try and give you what our best current thinking is and outline. I think that'll be kind of the first thing I start with after Ben's initial section. So we will get there, and that's a good question, but it's not fair to start with the hardest question maybe that could be asked today.
Good question. So this initial piece really is we're just going to go over kind of what we've heard from DOE and from US DOE about recommendations going forward, and then we'll dive into a little bit more specifics. So back to these minimum standards for hybrid that are recommended from DOE, Maine DOE. So grading and achievement, another highlight to focus on. The plan should take into consideration inequitable conditions and students accessing their experiences. So supervision, technology, materials, study space. We saw this come up over the summer, at the end of last year and over the summer, in terms of kids being able to access technology. That was a big one. Basic needs, including communication plans, plans to provide access to school meals, and overall, DOE's encouraged schools to develop plans transitioning between in-person and hybrid models. So not only do we have this framework of here's things you should consider when creating a hybrid or a remote model, but also an ability to shift between them, because it might be very abrupt at times. You know, there might be an outbreak and need to switch to all remote. Okay, I got 2 more slides, then we're switching around. So another topic we hit in our guidance, our school district is asking if we have a plan to keep our child home, and they gave the option of remote learning or homeschooling. What is the difference? Well, there's a big difference. And when we think of remote learning, we're thinking of school providing education just from a distance, as many folks saw back in the spring. But homeschooling is a whole different legal issue. And the responsibility goes on the family at that point and off of the school district in most all ways. And their website about homeschooling sums it up pretty clearly. Parents take full responsibility for the child while providing home instruction. They legally direct the child's education by choosing the curriculum, facilitating the process, and determining academic needs. Home instruction is funded exclusively by the parent. And we just wanted to highlight that there will be situations where families might be asked to make this decision between remote and homeschooling, and it really shouldn't be done under duress. And the family shouldn't feel forced into a situation. It should be an individualized decision made based on what the kiddo needs. And if there are health and safety concerns, which are very real, and some families are not going to feel comfortable sending their kids in, then that should be a discussion about what that looks like. So the team should meet, talk about what remote learning would look like, and that would be a student that's still within the school. So that's much different than a homeschooling option, which is more of a break from the school.
And can you talk about, under special education, what services a homeschooling student might still be able to access? For example, could they still access speech and occupational therapy through the school?
Sure. So the answer is very little, and it varies from place to place. So the state has opened up the idea that if homeschooling kids access some amount of school, maybe a class here or there in their district, then they may provide some amount of special education to do with that. But this is different in the sense that this isn't an IEP. There might be some type of learning plan that everybody's on the same page. They're going to go to this one class, and therefore they're going to also get direct instruction in that class. But the answer is they don't have a right to FAPE. They don't have an IEP. So it's much different. And I don't know if Atlee, you want to add anything to that?
Yeah, just to underscore that, I mean, it's some schools do provide a significant amount of services sometimes to students who are homeschooled or students who are in private schools, but some schools provide very little, and there's just not an enforceable right to a FAPE if you're homeschooled. And I just wanted to see, I saw someone put in the chat, you mean homeschooling, not home instruction, correct? And it's really confusing because that quote that Ben read from the Department of Education, that's from the Department of Ed's website, and they say home instruction. But what they're referring to there is homeschooling. And so there was a lot of confusion, I think, from March through the present, where people, you know, they didn't know, everybody was using these terms very loosely. So when DOE is saying home instruction there, what they're referencing is homeschooling. And when parents are asked, well, or they're told, well, if you don't like this, then do you want to homeschool your child? They need to understand that's the choice that, you know, that they're making. So what our recommendation would be is if you get in a situation where you're being pushed, you feel pushed to make a decision to either take on responsibilities that you don't feel comfortable taking on. There's nothing wrong with homeschooling, but homeschooling should be a choice you make from like a position of power, not a choice you make because you feel like you have no other options in the school. You don't think the school can, you know, meet your child's needs, and drag it into the IEP team process and have that conversation and say, here are the real health and safety concerns that I have. Here are the real concerns that I have with the model that you're offering right now. Here's some medical backup and support for my concerns. And let's discuss how to provide my child a free and appropriate public education because I don't want to take that on fully myself. So it's just, one thing we're worried about is that a lot of parents are going to kind of get pushed into homeschooling before they fully recognize the implications of that decision. So,
yeah.
We've got this question asked a couple times, and you might be addressing it later because it's a pretty popular question that we get from parents. If parents are choosing for fully remote learning for their child, can they request for an ed tech to come to the house to do in-person work with their child? Or off-site somewhere else, maybe not a home, but off-site away from the school to do some in-person learning with that child?
It's a little bit wrapped up. We're going to answer that directly, but it's also kind of the way you just asked it is kind of aligned with that Waterville question, which is one of the tougher questions, right? Like,
yeah.
So we're going to address the situation that if a school is not willing to provide in-person instruction, it seems like most are providing it in some ways, but we're going to address like what you can do if that's the case. But if a parent is choosing something, then it could get more complicated. And I think it gets more into that Waterville question, and we'll address that as well, but I'm just going to preview that we might not have a clear answer on that. But if a child needs in-person instruction to receive a FAPE, then they should receive that. And the question is just going to be about how. So sorry, Ben.
No, that's okay.
Yeah.
I'm gonna
just to circle back to the homeschooling real quick, can you address if a child is duly enrolled in homeschooling and public school?
So they are enrolled in public school.
So the question was asked, what if they're duly enrolled in homeschooling and what if a child is duly enrolled on a part-time basis? And I asked duly enrolled in homeschooling and public school, and her answer was yes.
Okay, so they have an IEP. So you just go through if you have an IEP, then you have a right to a FAPE. And there could be some other arrangement that's going on there. But if you don't have an IEP, you don't have a right to a FAPE. And if you're strictly homeschooled, while you might receive some services from the district, there's not an enforceable federal right to that.
Yeah. And that could be a matter of language too. Perhaps that's somebody that has an IEP that recognizes a kiddo that might be home some of the time, and that's something the team decided. And so that would be fully in public education in the school, but it has a component of home-based in it. So just to highlight that. Okay, I think. All right, Allie, you're up.
Okay.
Okay.
This gets to the water bill question a little bit. And I'm just going to go through these couple slides, and then we may have some discussions about it. And I saw, Janet, where you indicated in the box that, you know, that you wanted a little bit more information about the ed tech piece. The reason it didn't answer the question is there's not an easy answer. So, and there may not be an answer. So some schools may be saying to parents, and it sounds like from this chat that more schools than I knew about are doing this, is that you have a choice of an all remote learning plan, but if you choose that, we're not offering a FAPE. Is this okay? And our answer is no. But I think that this is going to be something that creates a lot of, there's going to be a lot of dispute about this particular point. Our view is that schools have to provide a FAPE to students with disabilities, whether that instruction is remote, hybrid, or in person, and that the IEP team, and this isn't a radical idea, should meet and develop that plan. So right now, a lot of parents who haven't even met with their IEP team since March are being asked to essentially choose something without the involvement of the IEP team, which we think is problematic. So when you're in doubt and you feel like you're being pushed to make a decision, I would request an IEP meeting and bring that decision process into the place that it's supposed to be for students with disabilities, and that's at the IEP team. Now, I don't know necessarily what's going to happen when you ask for things like an ed tech to come into the home, but I know that the place you should ask that question is at the IEP team meeting. And then the school should respond with a prior written notice that explains why they won't be doing that and what they considered instead. And so that's the best answer I think probably we're going to be able to give to a lot of questions is drag it into the IEP team meeting. Don't be pushed to make these determinations on your own. And if you request things like a one-on-one ed tech or something through the IEP process, there will be a paper trail of you requesting it and the school's response. And if there has to be a fight about it, then there can be a fight about it. But don't just give up any rights or be pushed into saying, yeah, okay, well, I'll give up my right to a FAPE, which is, I think, potentially some parents are being pushed in that direction. So Ben, can you go to the next one real quick?
Can I just jump in real quick?
Yeah.
We're getting a lot of questions about IEP requirements. And like, for example, can't they just temporarily delay IEP requirements if the first few weeks of school are part-time like Bath? And I want to just be clear, perhaps we weren't at the beginning, that nothing has been waived at this point in time. If Atlee or Ben, maybe you can speak to that as far as IDEA is concerned.
Yeah, nothing's been waived. I understand, and I'm trying to not monitor the chat so I don't get distracted by it, but I'm seeing all the people saying they've been asking for IEP meetings for a long time. I get that. I think that it was very short-sighted of schools. Some schools just shut down the IEP process in March. Other schools just kept on, and they had annual meetings, and they had meetings, and I went to more than a few via Zoom, and I found it to be actually a fine replacement for, under the circumstances. And so the schools that had no IEPs meetings, and they have a lot of overdue IEPs, and they have a lot of families who are being asked essentially to agree to changes in placement outside the IEP process, are going to really have a backlog and a struggle. And so I think that you should insist on an IEP meeting before you make any decisions. So if a school is saying to you, you have to choose this, we need your choice, what's your choice? I would say, I would put it in writing in an email to the special ed case manager and the special education director and say, I cannot make this choice without consulting with the IEP team meeting. Here are all the dates in the next 2 weeks that I'm available, dates and times that I'm available for a meeting. And that's where I want to be able to make this choice. And I get that that's not how things have been happening for the majority of people, but that is, I think, where you have the best chance of ensuring that your voice is heard and your rights are protected by just helping slow down the train and saying, no, this is really big. We should have met already, but we definitely need to meet before I sign something or say that I'm making this choice because it should happen through the IEP process. Does that answer it, Carrie, you think?
Yeah, I think it does. I think, every district is different, and we've been hearing from parents statewide. Some have been able to get a virtual or remote IEP and others have not. And I would encourage you to work up your chain of command. I know MDOE is encouraging school districts to have virtual IEP meetings whenever it's possible and have been since March. So if your district is fighting you on that, you can contact Maine Parent Federation and we can help you work up that chain of command to assist you in making sure that you get a virtual IEP meeting with your district. I have had a couple questions about masks. So where I'm getting duplicates, I'm trying to get those addressed, and then I'm saving the other ones possibly for later. So I'm not ignoring questions that are coming in. I just want, when we're getting duplicates, I'm trying to get them addressed. And so just a couple questions about being able to use face shields or clear face masks. Are these meeting the safety criteria? And what happens if a student can't wear a mask and they're being told they can't go to school? What are the protocols for those two things?
We're going to get to that.
You are? Okay, great. Awesome. So you guys can continue. Thank you.
Okay. And so this slide's just highlighting kind of what we already went over, but we heard that at least one school district, and again, now it sounds like multiple, are saying, like, if you want a FAPE and you're a student with a disability, our offer is in-person remote instruction. And so if you say no to that, then you're kind of waiving your right to a FAPE. And so I don't know how the law is going to evolve or develop in this area. I think there are potentially some circumstances where a school might be able to take that approach in a way that was defensible. But if they're making that decision unilaterally and outside the IEP team process in a way that's not individualized, then I think it's very likely that they're going to run into some significant problems. So again, I would drag anything like that. If you're being kind of told that this is your choice, we need your decision, just drag it into the IEP process. Again, I'm going to sound like a broken record, but send an email, say the next 2 weeks I'm available all these dates and times, really look forward to meeting with you. And then we can decide all together, because that's just how it's supposed to work. And again, if you only take one thing from this presentation, it should be that the world has changed, but the IDEA has not right now. And so you're going to have to kind of help ensure that the school helps you approach this changed world through the IEP process, which is unchanged. Any decisions you make outside of that process may cause more problems kind of down the road. So
let me just piggyback one quick thing. In that same idea, the fact that IDEA hasn't changed, also the IEP hasn't changed. So in the situation where you're trying to get a meeting, you know something needs to be planned for, and you want to meet, you have a lot to discuss, the student's IEP stays the same that whole time. So this is not a situation where, even though there might be urgency on the part of the district to say, well, we need to change things, that's okay, that's a shared urgency, let's meet then. Instead, the IEP is going to stay the same, and that might be a 5-day-a-week IEP with everything that you like and you want in there, and that's the IEP until it's changed by the team. So just highlight that.
So guys, getting a lot of questions about IEP requirements specific to the minutes of services that a child is qualifying for, and ensuring if a child's doing remote or hybrid model, that those minutes, I mean, they're supposed to maintain those same number of minutes of specially designed instruction, OT, PT, and speech, as well as have access to one-on-one support if they're getting a one-on-one support within their IEP. And are they, will they get the same pull-aside support within a general ed classroom in a hybrid model? Or if you're going all virtual and remote support, will they get that same one-on-one support through a remote model? So those types of questions in regards to making sure that IEPs as they're written are being followed, including one-on-one support, and what it would look like.
So I think I'm going to get to that very shortly. So, and there's a lot in there, but I will try and loop back to all those questions. So just finally, and I want to make sure people take this away as well. Under no circumstances should a school ask you to sign some sort of waiver as a condition of receiving a public education. And if you're asked to sign a waiver in order for your child to receive educational services, whether that's a liability waiver, whether that's a waiver of the right to a FAPE, we are interested in hearing about those things. And I'm sure Maine Parent Federation is as well. So this has been a problem more nationally than so far in Maine. So I mention it in the hopes that we don't get a lot of calls. But if you were put in that position, please reach out to our office or Maine Parent Federation or somewhere else to try and get some support about that. This, I think, will kind of catch those IEP questions and some of the others that I've seen in the chat. And maybe it'll help people kind of understanding the basis for the confusion here. So the question is, our school said they'll continue to try and meet the intent of the IEP if the school is either remote or hybrid at any point in the year. Is that all they have to do? No, that's not all they have to do. Schools are required to provide a free and appropriate public education. They were required to in March and April and May. To be honest, they're probably going to get a bit of a mulligan on that, I would imagine, in the courts, if they really did everything that they could to meet the intent of the IEP, right? I don't know that our office is going to be taking a lot of cases, I'll say, where the only issue is what happened in April and May of 2020, right? And because there was a real sense of an acute emergent situation that schools didn't have time to plan for. That is not the case today. And the law hasn't changed. And we've had a long time, 5 months now, to plan. And so schools are required to provide a FAPE, and that means an education delivered in conformity with the IEP. That's the definition of a FAPE. And so if your child has an IEP and it hasn't been implemented since March, and the school's not planning to implement it in September, really, they need to have an IEP meeting to have a discussion with you about how they're going to develop an IEP that does provide FAPE. Because if they're just not going to implement it and they're going to make unilateral changes, they are on extremely shaky legal ground. Ben, can you go to the next one? I think it's still the same topic. So just to help people understand this, meet the intent of the IEP language. It came from very early guidance from the State Department of Ed. Again, I think it was in a time when really everybody had just been blindsided by the need for schools to close in a very short order. And what it said in full is for students with IEPs, then schools have to ensure that each student is provided the special education and related services sufficient to meet the intent of the IEP. And it goes on to say to the greatest extent possible in light of suspended instruction. At the bottom of that slide, you'll see the FAPE standard was not altered following this emergency closure in March. It's not been altered since. And so really, while again, I think there may be some reason and schools may be excused in some ways for what they did or didn't do in March and April and May, I think that it is right. And it's really the only thing that parents can do right now is to insist on the implementation of the IEP or a meeting to develop an IEP in light of this changed world. 5 months, it's not unreasonable to ask an IEP team to have met in 5 months. And for schools to be telling parents right now that they need to just accept another kind of unilateral change and they don't have time for an IEP meeting, I think you should say no to that. I think, Ben, even the next slide, oh no, I took some things out of there. So did that address the questions? I haven't maybe been seeing all of them, Carrie, did that address some of the IEP implementation questions?
I haven't seen a response, but I've been trying to listen and address some of the questions at the same point in time. So,
okay. Fine. Sorry.
No, it's okay. If somebody follows up and says they need more, I will let you know.
Okay. Ben, I don't want to go past where I'm, is this our?
This is still you, but I can jump in
Okay,
if you want.
no, it's fine.
Okay.
This section talks about the situation that I know many people feel like they've been in, is that you have a child who just hasn't been able to access education since the disruption. And it's a small number of kids probably across the state who really had zero access, but we've heard those stories. And I know some families just said, what meager remote instruction we're being offered right now is so disruptive to our day, and our child's getting so little out of it that we just can't do it. And other students would just not engage in this format in any way, and couldn't engage without any significant support. So can I request in-person services? And yes, you certainly can. You should do that through an IEP process. And the only way some students are going to receive a FAPE is through in-person services. I think there are situations we're aware of where in May, everybody agreed that that was the case, but they said we still can't provide in-person services. Well, it's different now. Every school district in the state is in a county that has been categorized as green by the state. So there's no reason why, even if the school didn't feel comfortable providing in-person services to many students, there's no reason why it couldn't provide in-person services to students who could not otherwise benefit from instruction. So yes, you can request those. You should work with the school to develop a plan to provide in-person instruction safely to students who'd be denied education without it. Can you click over?
So I think it's important to note, just because we've been telling parents about requesting in-person assistance, that some of what we're getting back, and myself included, because I asked for the remote learning days if my daughter could get the ed tech to come to the home. Some of the pushback I'm getting from the school, and I didn't think they'd do it, but I wanted to hear what they would say, is that we can't send somebody in person to your home because it increases their risk for getting COVID, as well as your child's risk for getting COVID if they're going from home to home to home. So I think when we consider in-person learning outside of a pandemic, when a child is medically fragile and can't go to school, the risk to exposure is just to the kid. Now we're looking at the risk of exposure to both the child and the individual that would be coming into the home and doing the learning. And that's the pushback that I'm hearing from parents across across the state when they do request this in-person service. So what are your thoughts on that?
Well, I think a lot of this is going to be, and this is why it's very difficult to just provide this type of training, because the legal landscape is shifting. But the response partly is going to be on the why they're requesting it. So all those kids who got homebound education before, because they were medically fragile or because they were in the hospital or something like that, I don't see any reason why a student in that exact same situation shouldn't get the exact same services. There are individuals providing in-home services, Maine Care funded services, and who've been providing in-home services for months and months. Some never really even stopped. But so that's kind of something off to the side, right? I think that's it's a small number of students across the state. And if they really cannot, and there's documentation that they cannot leave their house, and they cannot receive a FAPE without instruction coming to them, those students, I believe, still get those services. There's now a whole new category of students, and these are the students I don't know what's going to happen with, and I don't know how the law is going to develop. But that category of students are the students whose parents don't want them to leave the house, or don't want them to interact with other students. And that's going to be a trickier deal. So the more medical documentation you have about the can't leave the house, the more likely you are, I think, to get services pushed into your home. If, however, you're trying to get in-person services, maybe the school's remote. Let's say this example is the school's in a hybrid model, and on those remote days, your child cannot benefit without adult support. I think the request, you could certainly make the request for the home, but I think the request that's more likely to be granted is, well, the child can come to school and still get the one-on-one support, but because their hybrid cohort is home that day, they could be in this other room with ed tech support, accessing the same way they would be doing it from home. So taking the home piece out of it, I think those two ends I can answer. The stuff in between, I have no idea kind of how that's going to shake out.
It seems to be different across the districts because now we're getting inundated with all different reasons as to why school districts, like somebody was told that MDOE has restricted them and will not let them do that. Someone was told that it would cause employment issues within the school district. Someone was told that if they provide that in-home support, the child must still wear a mask, which is probably true. I know with in-home behaviors and supports, that's being required from some agencies. And then the other question was, if we go back to full remote, does that allow to push for more in-person learning then? So it's kind of, I think this is the local control isn't necessarily a bad thing, but this is the issue with local control. It's looking different across the state, and how parents are asking for it and the reasoning they're getting for a district not providing it are going to look different across the state of Maine. And I think that it doesn't mean that you don't ask for it and navigate the processes, which you can do, which I've worked with the AAP pretty closely this past summer, and I've given them warning that they're going to be inundated by their parents to provide letters saying that their child can't attend in-person services for this reason. So they've been preparing for it as well. And in addition, you have typically developing students who might be living in a home with a child or a parent or a grandparent who might be compromised, also requesting the same type of services, and they're not necessarily protected, or they're not protected by IDEA. So, the reasoning, I don't know that Ben and Atlee can navigate every single reason that you're being given for not providing in-person services, but what they can do is, and what they're doing is providing you with the guidance and the approach to take in asking for it, if that makes sense. I don't want to put words in your mouth, Atlee and Ben, but I think that's kind of the general umbrella that you're trying to provide for families right now.
No, that's exactly it. And just to follow up on Atlee's point before, there's a spectrum, and no matter where folks fall on the spectrum of what a kiddo might need to access their education, the school needs to engage in the process of considering how to accommodate them. So it might look a lot different, home versus school versus fully gowned PPE versus in the parking lot. There's a lot of different creative solutions that schools are going to come up with, but they need to engage in that process at the very least.
And I think, again, setting aside the really small group of kids who would have been getting homebound services even if we weren't in a pandemic, then that category certainly grew. I would imagine there are some kids who were safely attending school before who couldn't attend now, and so setting aside that group, I think parents will be in the best stead if they take advantage of as much as the school is providing, and accessing, like, again, say that you're on 2 days a week. I saw something in the chat asking, I'm in 2 days a week remote, and then 2 days a week in person. In that sort of situation, if your child is going to the 2 days a week in person and you say the 2 days a week remote won't work, then asking at an IEP meeting, saying at an IEP meeting, look, I've got a 5-day-a-week IEP already. I'm not willing to agree to go down to 2 because my child can't benefit from that. So let's talk about how to provide those services at the school. I think asking for people to come into your home is always going to be hard. And the more that can be limited to the students who would have been getting homebound services before this, or who it can be really explained and supported medically why they are at really heightened risk, would probably be best. But I understand the concerns many parents have. I'm just saying, I don't know how it's going to end up happening. And my guess is the more requests schools get for this, the less they're going to want to do it, because schools have some acute staffing issues going into this year. And there are a lot of teachers and staff who aren't going to be reporting necessarily for duty as planned. There were a lot of early retirements. It's not going to be like there's a whole long list of folks ready to go into lots of different homes. So I know that shouldn't matter, but I think it will matter because it's just the reality. And so the more that you can kind of make your requests and look at what problem is it that we're really trying to solve, The problem is, okay, on the days that my child is on the remote wing of a hybrid model, they need adult support. Where can they get that adult support? Can it be provided at school? That's probably more likely to, even if they're, off on their, on their own, because the rest of their cohort is at home. That's probably a better way to approach it, or more likely to achieve a good outcome. So we'll move on from here.
Yeah, you're already on this.
Okay. Oh, look, we're already here. So they want to change the IEP to reflect new 2-day-a-week schedule. I want to underscore something that Ben said. If your IEP team hasn't met since the March closures, you have an IEP, unless you agreed outside the process to change it. You have an IEP, and it's reasonable for you to insist on that being implemented. Now, I don't know legally how the law of stay put is going to shake out under these circumstances. Are there some IEPs that, even as we sit here today, cannot be implemented? Maybe. But the fact that every school is green, is identified as green, then I think what schools would be best to do would be to have IEP meetings and talk with those parents and come up with a plan and say, look, here's our reality right now. We only have half the students in the school per day, and we're not having anybody come on Friday, but we want to ensure that we provide a FAPE within that framework. So we're thinking about a 4-day framework, and how do we ensure that there's a provision of FAPE and come to some sort of consensus and agreement. Where schools are going to get into trouble and where they're going to make a lot of you sitting there upset and anxious and angry is when they just change things like they did in March for September. Because again, I think in March, we were in an emergency in March, and it's not that now. We've had a long time. There've been hours and hours and hours of meetings in school districts across the state to plan for this. And if they haven't looped you into that, then I think it's reasonable, and it's the best thing for you to do is to, at the outset, insist until they respect the process and bring you into an IEP meeting and try and bring you on board. Insist on the implementation of the IEP, because you're not going to get it back very easily, right? If you agree to less services, then you're going to have to fight for more. And so don't do that outside the IEP process. But by all means, work with the school. If there's a way within their 4-day-a-week model, if that's what they're doing, to provide your child with a FAPE, come to that agreement with them. But just know that if you just kind of accept a change outside that process, it's going to be harder probably to fight to get it back. So I know this is like very confusing, and I wish that there were more black and white answers, but I think we'd be doing you a disservice if we were any clearer really than this. And it's just drive it and drag it all back to the IEP. Already kind of highlighted this, but if you're not confident that whatever the school's proposing to do will meet your child's needs, have an IEP meeting. And if they're going to change it without your consent, you can file a complaint with the State Department of Education. We have links to it in the guidance that went out today, in which I posted links in the chat. Or you could file a due process hearing, or you could ask for a mediation to just say, can we come together and resolve this with the school? Any of those things will freeze the status quo and invoke the stay put IEP. So while the dispute's being resolved, they have to implement the last agreed upon IEP. Now, again, I know that there are some IEPs that perhaps schools will argue we cannot practically do this. I'm just telling you what the IDEA requires, and it hasn't been changed, is that in Maine, unless you have an IEP meeting and you try to reach consensus and you still don't agree, and you give the parent 7 days advance written notice of what you're going to do, you can't just change the IEP meeting. So the IEP. So that's what I think families should insist on. I hope schools have planned for this and have brought people to the table. But based on what I'm seeing in the chat on the going as I'm talking to you, I'm worried that they haven't. And it's going to end up causing a whole lot of problems if they haven't had any meetings in March and they're just going to expect families to just accept whatever they're offering without a meeting and start in September. So I think that's it. Ben, you're up.
So another way to look at this is there's different tools that are in IDEA that are underutilized. So in that same situation, Atlee was talking about the schools saying, we're 2 days in person, and the rest is remote, and it's clear to you that the kiddo needs more than those 2 days in person, well, you could frame it as ESY. So everybody knows ESY as a term that has an IEP. It's extended school year, and typically it shows itself as summer services, and it's some amount of maybe 6 weeks and a certain amount of related services, but that is not the limit to ESY, even though that's the most commonly seen form. It could very well be a part of the regular school year, just outside of regular school hours. So in this example, where a student needs 4 days in person, that's something the IEP team agrees on, and they're only offering 2 days. 2 days could be added to the IEP as ESY. So the kiddo has essentially a 4-day-a-week program. 2 of those days are the same days that all the other kids are going, and then 2 days they're going to be in person as a part of ESY. So just another way of framing it. It doesn't have to be, you don't have to use this ESY angle, but it is language that is available, and it's a framework for providing more than the regular school hours. And okay, this one. The question is, my school district wants to create a contingency plan or a remote learning plan, depending on what people are calling it, in the IEP in case we need to pivot to a remote or a hybrid model. Is this okay? So what we've decided is, yes, we think this would be okay and probably advisable, because there is going to be disruptions to the typical, the new typical, right? So there's going to be anywhere from 1 to 2 to 3 to 4 or 5 days a week in person, and then they're going to switch around if there's an outbreak. There's going to be changes, so the IEP team should plan for it. And the way they could do that is through some type of contingency plan, remote learning plan. And I know DOE is contemplating this and telling districts, you should think about this model too, this contingency plan. I think the most important thing to emphasize here, and where districts could go awry, is that it has to be a part of the IEP team process. It's possible that the school and the family agree, let's just go ahead and create this plan. Everybody agrees on it. We will do it as a part of the IEP process, but you might not need a meeting. That's possible. But if it's sent to you as a parent and it says, here's your contingency plan, you're going to get half the amount of hours of OT when the kiddo is on remote, and do you agree? That if it's that type of approach, that's not appropriate. That's not through the team. So I think, just to reiterate Atlee's broken record, drag it into the IEP process, call a meeting. That's where the plans should be developed. And it just makes sense too, because having multiple IEPs would be very confusing. And the IEP is a very fungible document. It can be made as long as needed. And so that service page could be explicit and say, hey, we're on remote, we switched to remote to hybrid, here's what it's going to look like. The team agrees to this, and it spells it all out right in the IEP. And so that's a way to approach it. This is just
you used ESY as an example, so somebody's just sort of following up. Can you use the ESY argument if they offered ESY to us remotely and my child is unable to learn remotely with his level of disability?
Well, that might go a little counter to the idea with using ESY as a mechanism to get what the kid needs would be something as added on to what is in the IEP. So if the IEP says 2 days a week and then you need 4 days, you could add those 2 days. But I guess that would be counter to providing the kid faith. If the school's saying, well, ESY is just remote for these extra 2 days a week and you can't access that, then that's not going to provide faith. So my guess is that question might go back to summertime, because most people know of ESY as a summertime service. And there were certainly situations where all the school was offering for summertime ESY was remote, and there were kids that needed in-person services. So just going back to that slide, when we were thinking about, can you request in-person services? Yes, you can do that for ESY in the summer. You can do that for the regular school year, if that's what the kiddo needs. So I hope that.
And you guys are going to address compensatory services, correct? because we're getting
Yep.
a couple questions. And just so everybody knows, compensatory services is another way of saying making up for any sort of lost services the child did not receive during March through June. So we had a couple questions about those services, and Ben and Atlee are going to address those as well.
Yep, we will. We will, yeah. So just finishing off on contingency plan. So just insist that there's a clear plan, go through the team, and avoid any of those soft, general wording that you sometimes see on IEPs, as needed, as available. That's not specific enough. You know, if the team's meeting and they're establishing what a kid needs, come up with numbers, come up with days. And also it would be good to have some kind of mechanism in that plan saying, if we go on for 30 days like this, let's come back as a team and meet. You know, that's just an example, but something to trigger the team to re-engage in case it stays on the contingency plan too long. So another question we proposed. My school district said they cannot provide in-person instruction of my child because that would be not the least restrictive environment. Is that true? So this is a little bit confusing, but we hope to clear it up. So when folks are using the term least restrictive environment, or LRE as it's known, this approach is misapplying what LRE is meant to be, because LRE is meant to be accessing mainstream peers to the maximum extent possible. And so if a school district is still on remote only and they're providing necessary in-person services to a student with a disability, that's not a violation of the LRE, because if you're remote, you're not accessing your mainstream peers to begin with. And I think I have a couple more to clarify that more, but for students who are unable to benefit from remote instruction, or students for whom the continuation of remote instruction will result in the denial of FAPE, then in-person instruction should be provided. So it goes back to that same piece we're talking about. If a kiddo needs in-person instruction, they need it. And the team should engage and talk about how that can happen. And just to highlight the LRE, the real issue of LRE, it's possible that with in-person aid for a kiddo that is remote, on a remote plan, that might make them able to reach the mainstream classroom, the general education classroom. So you could imagine a situation where a kiddo is on remote in the sense that that's their status, but they're getting some in-person services to be able to access that remote learning. That might be something where they're also seeing their whole classroom through the remote. They're engaging in those daily meetings through remote. Those are all their peers. So that could actually provide least restrictive environment more access. Is that clear enough? This is a little bit more about LRE. My school district has said that my child will not be able to attend classes in general education setting because the students must be in pods or cohorts. Have requirements for least restrictive environment changed? No, they haven't changed. And this is another one of these terms that we've been hearing. So you're going to hear terms: COVID impact services, pods, hybrid, all these words. They're all newly applied and new definitions. But when we hear pods and cohorts, there's already many school districts I've seen that are choosing to go this route, which is anywhere from, I've seen 10 kids are in the same pod and they move together, and that's a safety approach. And the point is, LRE is not still there. And so the kiddos still need access to the general education curriculum and their mainstream peers. And so it would be a big red flag if all the students with disabilities who had access to the mainstream before were then suddenly part of their own cohort and separated. And so their schools would be best to avoid segregated settings, as always, but especially when this new cohort creation is happening.
And that guidance has been given from MDOE as well. I know I spoke with the Director of Special Education, Erin Fraser, last week, and she has told all her special ed directors that they should be doing everything in their power not to be segregating special ed kids. There was a question that came up, and I've heard this as well as being an option in order to comply with LRE, allowing special education kids who might be segregated to access their mainstream peers through a virtual setting. How do you guys feel about that?
You know, that's one area where I'm sure that there's going to be, it often has worked the other way, right? We've seen situations, and I'm sure some of the people on this call have worked with families where, you know, you have a student who can't be in school at all, and a great way to connect them with school is to have them virtually in their classroom, right? So they have a significant illness. There have been, you know, some robots where the student gets to participate in the classroom as a robot. To me, it seems different if they're in the next room, you know? And so I get what we're trying to do there, and I've heard people talk about that as a solution. But if I would encourage parents that have concerns about that as a solution to ask for a meeting and ask for the school to explain why that is a substitute for actual in-person contact. So it's, you know, I think this is an area, you know, we've highlighted kind of one area of concern. This is another area of concern that I have is that we are going to take some steps backwards with regard to students who have been having success in their classrooms, and they've been supported to have really meaningful contact with their peers, and that we're just going to, because of expediency, basically say, well, here's the pod, and so it's a special education pod. And so those cases, I would encourage families to say no until at an IEP meeting you're convinced that what they're proposing to do is actually going to be a meaningful replacement for that type of contact. And I don't think that I don't see how it could be. But these are also cases we're interested in hearing about. I just can't tell you exactly how it's gonna come down. This is new for all of us, right? It's new for the schools, it's new for you, it's new for the attorneys representing the schools, and it's new for the attorneys representing parents. And so there's some gray area, but this is kind of one of those pressure points and pivot points where I'm concerned we're going to take some steps back. You know, so sorry, Ben, to just jump in.
Nope, that's okay.
What about if a child can't wear a mask? How does that impact LRE? For example, you know, but they want to interact with typically developing peers, but they're unable to wear a mask.
We're going to get more
just
into
push
that.
all the mask stuff. Yeah, just push the mask stuff to like the mask time.
Yeah, we're getting a ton of.
Yeah.
We're going to get to mask time soon. So just back to the LRE idea. Another thing to remember, as we talked about with the existing IEP and with providing FAPE to the student, LRE is the same in the sense that it hasn't changed in that student's program too. So the law hasn't changed and the IEP hasn't changed. So at the end of the IEP, there's always that percentage of access to the mainstream classroom. That hasn't changed unless the team met and decided that that kiddo is going to have less access or more access. So that's going to be a stay put issue, as we said. Okay, just more on pods and cohorts. Yeah, just saying, you know, specialized instruction can be pushed into the general education setting. These are all things that people know. It's just maybe there needs to be new learning on schools' parts if they make these moves towards trying to gather kids in appropriate ways. So pushing in services into the pod, providing access. If your school district is proposing to use pods and cohorts in a way to move the child to a more restrictive setting, you should think about dispute resolution. So we'll highlight that again. Okay, I'm still going here, yeah. We've addressed this mostly, but some folks have been trying to get IEP meetings for a long time. I mean, I heard of families that it was months and months before they even heard. They heard from some school districts that said, we're not having meetings now. I echo what Atlee said, that was short-sighted to put it off because there's so much planning that could have been done that isn't, or that hasn't been done. And now it might be a scramble, but that's not the scramble for the family to do. That's the scramble for the school to do. You've got your IEP, it's in hand. Your kiddo should have access to school. So these are just kind of recommendations, you know, write to the district, request the IEP meeting, suggest times, be open to doing it different ways over the phone, virtually. And ultimately, you know, if the school is not responsive to a request for IEP, I think we didn't say this before, but if they're not responsive at all, and it's going to affect the student's program such that they won't be able to get FAPE, or it will not enable you to be a participant as a parent, then that's a potential legal issue, and you should think about complaining about it.
So if they refuse, then you can go through the complaint process. I mean, if you've worked up your chain of command within your school district and you're still getting the refusal, then you would recommend the next steps is to go through the complaint mediation or due process. Use that.
Yeah, I mean, it
right of recipient.
Depends on the situation, but if you've been diligent and requesting a meeting and explaining why and offering time, you know, being very flexible and insistent, and the school's just not getting back, and it's totally necessary to have that meeting to plan for the kiddo to get, then yes, yeah, absolutely, they can use that state complaint process or due process hearing or mediation to resolve it, and maybe that's the push that's needed to get the meeting.
And there's
go ahead. Yeah.
Sorry, I mean, there's two types of IEP meetings, right? There's the annual meetings that should be happening, and some of those are, you know, overdue, right? So that's problematic, and everybody needs to work together to catch up. Then there's the meetings like that need to happen if conditions warrant, you know, or on parent request, and those, you know, could be in a typical situation, right? You have a new kind of concern, a new behavior, you got a new outside evaluation, whatever number of reasons, and a family requests a meeting, says we need to talk about this, we need to address this. Well, what student hasn't had changed circumstances since March? You know, whose IEP is actually appropriate right now for the current situation? We have kids across the state that have new needs due to the stress of this situation. We have kids who have regressed significantly, right? So it's not unreasonable for parents to be asking for the IEP team to get together. In fact, it's unreasonable at this point for IEP teams not to be getting together, is our position. And so if schools are saying no, they can always say no to parent requests, but it has to be in a written notice that says, we're not having an IEP meeting because, and I'd be interested to hear what their reasoning could be. It's sure not going to relate to the individual needs of the child for whom the meeting's being requested. So.
I think it's important just to in regards to LRE and segregation, because it's, there's one parent from my district who has made it quite clear that, yes, SACO is segregating students within special education, and it has been brought to their attention, and they're have admitted that they're segregating students. And so I want to make it clear that your child, there's been nothing that's been waived in IDEA at all. So your child cannot be put in a segregated environment at this point in time because of the virus, because of an identification, because they're in special education. That is flat out segregation, and it does violate their least restrictive environment, and you do have rights around that. And if you bring them to your school district and make sure that you make them aware that you know it's a violation of IDEA, and start using that language, you'll probably get some attention around that. Although I have done that in SACO and at a town hall meeting, and their response was probably a good 5-minute response, which basically said that they understand they're in violation.
Yeah, you know, again, we can only tell you that the law hasn't changed. So if a student has an IEP that says that they are spending 50% of their time with outside of the special education setting, or 75%, and that goes to 0, and there hasn't been an IEP meeting to discuss that, I don't see how a school could defend that legally. Now, if an IEP team gets together and says, you know, we understand this is important, but here's this one area where we're not going to be able to do that because of this and that health and safety situation, but here's what we're going to do to address that going forward, you know, and there's some give and take there, you know, then could the IEP be changed over the objection of the parent and then be legally defensible? Maybe. I don't know. But if they're not having the meeting and they're not having the conversation, I don't know how they think that they're going to be able to defend their unilateral action, that's what it is.
What about refusals to have IEP meetings because it's summertime and teachers don't work in the summertime?
That's a tough one. I mean, I think soon it's not going to matter because it's not going to be summertime. So I think, getting your IEPs scheduled for when everybody's reporting next week or the following week. But is a school going to be held to account if the parent requested an IEP meeting in July and they said we can't do that until August? Probably not. But if a parent started requesting a meeting in March and requested it in April and requested it in May and has now requested it in August and they're saying, well, we can't do it till late September, is that going to be a problem? Probably. So, it's just going to depend on the facts of the situation.
Okay, we're going to jump into some masks here. So the question is, my child's unable to wear a mask, and the school has indicated that if children do not wear masks, then they cannot come to school. What should I do? So there's a lot you can do. Masks, we just want to highlight that mask wearing is an important part of health and safety measures, and DOE has outlined that, CDC, DHHS, and it seems not in dispute. But there are some children who are not going to be able to wear masks because of their disabilities. They might be physical, they might be mental health. It could be a number of different causes, but whatever the outcome, that student might not be able to wear a mask. So there hasn't been a lot said by CDC on this, but they have said that there is guidelines that students who can't wear a mask, who can't take off the mask on their own, should not wear a mask. So that would be a safety issue for that student to begin with. And DOE highlighted in their framework also that clear face shields might be an alternative for students who can't wear masks. But it's possible students can't wear either. So if there's some disability related reason that a student cannot wear a mask or a face shield, it might be important to get medical documentation. I don't know if you have to have it. We haven't had that case, but it would be very helpful to have that medical documentation. And I know Carrie has already highlighted that the pediatricians should expect to be hearing a lot of requests around that. And perhaps they will write them, perhaps not, but it's a worthy thing to seek. So in those circumstances where a kiddo can't wear a mask or a face shield, then the IEP team should work to determine how best to provide accommodations. So we already started to highlight this with in-person versus remote. The same would go for providing accommodations to be able to have that kiddo access the classroom, which might be something, it might look a lot of different ways. I highlighted, maybe it means there's more PPE on the staff because the student can't wear it. It might mean there's a change in the location so that people are all safe. Whatever it is, that's something the team should discuss so that the student has access and gets a FAPE. I'll finish this one last one and then I know there's lots of questions with masks. Schools should be aware that there's a difficulty that face masks present for students who are deaf or hard of hearing, and must take steps to address any barriers to effective communication. So that's a whole nother issue to do with masks, but the issue is the same in terms of access. Kids need to be able to access the classroom, and if it means a clear face shield or a different scenario, then that's what the team should be talking about. So do we know I think, okay.
Yeah, so
yeah.
No, I think some of these other ones here, Ben, if you run through this,
yeah,
we'll address.
Gary, let me do one more
Great.
mask slide, and then we can do a couple hours on masks. No. So schools should be developing plans to teach students about masks. We wanted to highlight this because wearing a mask is going to be a skill for many kids, maybe more of the younger kids, or specific to their disability, but it's not something everybody's used to. They're starting to, I see lots of kids, out on the street wearing masks that I wouldn't think that kids that young would ever tolerate, but people are learning how to use them, and they're going to need schools to help them to keep those skills up and to learn how to use the masks. And that might involve providing students social stories or other teaching methods to prepare them for the return to school generally, but also specific to masks, you know, what to expect. And everyone's going to be wearing masks, and, you know, the social emotional piece around that too. You know, I've heard that highlighted by folks. It might be a scary image to see everyone in masks. So prepare students for that. So go ahead, Carrie, you can jump in with some.
So we're hearing that some pediatricians are refusing to write notes at this point in time for children. I mean, pediatricians are private providers, and there's other than, you know, the Office of Civil Rights, it's not really a civil rights violation for your primary care physician to say they're not going to write a note. That being said, children with special healthcare needs oftentimes have multiple doctors. So I would say that it doesn't necessarily have to be your primary care physician. And if you're working with multiple doctors, then to approach the various doctors with the concerns. For example, you know, my daughter has a cardiologist, so it could be some concerns there. She also has a genetic specialist who knows very specifically her needs as a child with Down syndrome. So there are multiple different pathways. I would also say to work with your schools on providing different options. I know face shields are an option, as well as masks, and you know, having that written into the IEP. But there are situations where you know, the general overarching question is, you know, schools are saying if the child's not wearing a mask, they can't come in. So for a child who has special needs, who might not necessarily have a medical note from a doctor, can the school refuse their right to in-person services if that's what they're offering their typically developing peers if they're not able to wear a mask?
Yeah, maybe. But the question is how do they do that? And then how do you solve the problem, right? So is it okay for a school to say everybody has to wear a mask? Well, yes, in fact, the state's requiring them to say that. And so if they're saying then there's a presumptive backup of a clear face shield. And if that's worn, then you cannot wear a mask. So it's okay to have that policy. But if that policy is preventing a child from accessing their education or receiving the services on their IEP, then you have to meet and solve the problem. And you have to develop reasonable accommodations. And you know, the solution may not necessarily be, this is a really tough situation, right? Because there are a lot of people who are saying we won't wear a mask. And so we got to separate kids into some different buckets. And there are some kids who the CDC guidelines say they should not wear a mask. And so if those kids also can't wear a face shield, what are we going to say? They can't have any education until there's a vaccine? You know, I mean, so there's got to be a team that comes together and identifies in an individualized way, what is the reason why this student cannot wear a mask? And I saw in the chat, somebody was saying the difference between can't and won't. Well, won't is a totally different. We have to teach kids lots of things. And like Ben said, we may need a really good plan about compliance with masks. We're probably going to need that for high school students without disabilities, right? But I mean, you're going to need to teach students this new expectation. And so that's one way to address it. But for the students who really cannot, then the team's going to have to come together and figure out how to safely provide the services and provide a free and appropriate public education. And this is probably the third area. You know, once we take the easy cases out at either side, where there's going to be some dispute, and I don't know when push comes to shove on this how it's going to shake out. But I can tell you that if schools don't engage families in an interactive process, through the IEP team would be best, on how to solve the problem, then they're on much shakier ground. And so if they're doing what's here in the chat and just saying, yeah, no IEP meeting, no nothing, we're not going to try to solve the problem, you just can't come to school, you know, that's going to be probably problematic for them. But are there some cases where a school might, after engaging in an IEP meeting, after having that discussion with the family, after making accommodations, they might still get to a point and say, this is as far as we can go for the safety of our staff, and take it or leave it? Then there's going to maybe have to be some fighting about that and some litigation. And I don't know how it's going to shake out. So it's going to be a tough area, but hopefully the majority of these situations can be resolved either through a clear face mask or through other sort of accommodations that could be made through the IEP process. But there are going to be some of these cases, I'm sure, that people end up having to fight about. I just want to loop back just 1 second for the medical documentation. I mean,
Yeah.
I really think that's going to be important. You know, if you're coming to an attorney for assistance and you're saying my school's, you know, saying, you know, my child can't come to school because they can't wear a mask, and there's no medical documentation, then when folks are assessing that case, it's gonna be difficult to think that that case could prevail. So I think it's going to be important to have people who are other than the parents, with training other than, you know, just being a parent, although I'm sure the parents, you know, are right, having someone else say that and say it in a way that links it to a disability. And anyway, that's I think I tried to loop back and capture those, and I cut you and Vin off today. Sorry.
I just want to, let me just push back the smallest bit on that, Allie, and say there might be situations where it's so very clear the IEP team recognizes this is a kiddo who's not going to be able to manage a mask based on the history of other clothing related issues, you know, whatever it is. It might be so obvious that to the IEP team that you might not need a letter. It's just very good and you really should get one.
Yeah, so. No, that's fair. That's fair. But letters will be important, I think, when push comes to shove.
Yeah. I would also say we get somebody that said schools are saying that DOE is saying that face shields are not going to be acceptable. That's not true. I think if you look at MDOE's guidance, it does say that they can use alternatives. It doesn't say specifically face shields, but face shields are the most popular alternatives. Also, can you guys speak a little bit about if you know about reasonable accommodations for kiddos who are deaf or hard of hearing, you know, that can be adopted by other kids, not just teachers and staff, to ensure adequate communications. I mean, passing around a mic right now is something that would be a red flag because we're not wanting kids to share equipment and materials. So are there any other reasonable accommodations you can think of so that they can have peer interaction?
I would just say that to me, face shields is just a better way to go. I mean, you're as long as it's safe and everybody approves of how safe it is. I know there's now face shields that have, you know, clear, they go upwards as opposed to outwards, and so it eliminates some of the spread. But, you know, there's this concept of deaf gain that people might know, which is there are certain things that are accommodations for some people that benefit all people. And so face shields might just be a way that everybody can communicate better and it will meet the needs of more people. So I just want to highlight that.
Or also clear face masks, I think you mentioned as well, which are hard to get right now, but I think they're getting easier to get, and advocating for your schools to obtain those so that everyone in the classroom could wear it would be good. I hope schools are already kind of in queue for those things. I know some schools are.
Yeah, so that kind of brings us to the next question, Atlee. Who's responsible for providing the facial coverings that are different from typical masks? Is that the parent's responsibility?
I don't know what schools are doing on this, but, you know, I think if families if a face mask is required to come to school and you can't receive a FAPE if you don't have a face mask, and education is supposed to be free, then I don't think requiring the family to provide it would be appropriate. But I haven't heard of how schools are addressing that particular question. But the F in FAPE stands for free. And so if families are in need of required equipment to attend school, then I would assume that.
It's my understanding, and I got this information from Dan Schutter, who's the Deputy Commissioner of Education, that the Maine DOE has bought enough PPE and masks for students and staff of our Maine schools for 3 months. Whether or not that includes some of these alternatives, I am unsure of, but if a child shows up at school without one or forgets, there should be one available for them at school. Or if a child can't afford one, then the school will provide that for them. And I know there are a ton of mask questions. There was one about if a kid becomes distracted while wearing a mask. All those things are very individualized needs. And if the child has an IEP, are things that should be discussed at the individualized education program meeting. I know at my daughter's meeting, we were given the alternative of face shield. So I'm sending her both with the mask and the shield. That being said, anything that you're going to put on these child's faces are going to become distracting because of their needs and difficult to navigate and no real good answers. In fact, it was just 3 weeks ago, I was meeting with some DOE employees and asked the mask question. And really their answer to me was there are no great answers for that. And so it's, I think we're still in that state of there are no real great answers for the child who just can't wear one, and their rights are being violated because they can't wear one. And I hate to, I know you're coming to get answers, but there are just some situations right now where nobody has the answer. And really it's going to have to play out in school, unfortunately.
But I do, at the risk of sounding like a broken record, I do have an answer, and that is that these questions need to be resolved through the IEP process, and the problem needs to be dealt with, through that process. And you might get to a point where you guys just can't agree, and you feel like your child's needs are not going to be met because the school won't bend any further on what it sees as a legitimate health and safety requirement. And that's where I no longer have answers for you, exactly how that's going to play out. And it's going to depend very much on the facts of that particular situation. But schools can't just say this stuff and expect you to just be okay with it. They need to bring you through the interactive process and try and reach consensus through the IEP process and come to the table and try and solve the problem. But there are going to be situations, I think, where people aren't going to be able to resolve these issues. And I don't know how that's gonna shake out. So
for kids, just to circle back, for kids who are deaf and hard of hearing, should the school be responsible for providing clear masks or face shield to their peers in their class so that they can speak to them?
Again, I mean, I think that'll come to the IEP team in terms of if that's part of the student being able to learn social skills and that's part of a goal in their IEP, then there might be something to hook it to in that way. We don't know, there's nothing that says that, right. But you could make the argument that a kiddo would need that.
And okay. One other thing, and on the last slide today, we'll say essentially this was about the IDEA, but on the communication piece, there may be circumstances where the Americans with Disabilities Act might have a more robust requirement than what the IDEA would have. And this could be one of them, I think. And so I would, if I'm making the request for the school to ensure that everyone in my class is wearing a clear face mask and that the school provides those, I would also mention the Americans with Disabilities Act and say that to ensure effective communication access to this classroom, even if the school may later say, well, you don't need it to receive a free and appropriate public education, I would just use the language of access and communication access, because there are some areas, and I think effective communication is one of them, where the ADA could certainly provide a kind of a clearer vehicle to enforcement of rights. And a right to effective communication is a right that's clear in the ADA. So.
Okay, I think we should move on from masks. I know there are a lot of questions, but there's a really good question about speaking to compulsory attendance mandated by the DOE on schools measuring and monitoring academic functional performance of students for this academic year. It is my understanding that schools had a grace period in measuring functional goals, academic performance from March through June, but that grace period has since ended. And I'm wondering if that's coming up, but I know, figuring out the child's present level of performance as we look to readdress goals on a child's IEP, as well as look at regression and compensatory services, are kind of all connected. And I thought maybe that could transition us to that concern.
Yeah, I think we're shifting to you now, Atlee.
Oh, okay. Sorry about that. Yeah, so that was a good segue. It's like we planned it. So there was a lot of missed instruction from March until now. And so what can be done? And this gets at some of the compensatory issues. I'm not sure it will fully answer the question you just asked, Carrie, because I'm not sure there was no grace period that I'm aware
I
of.
did, yeah.
Or
Me either, but
so I think that question had to do partly with attendance, and my understanding is that DOE's expectations for remote and hybrid learning are going to include daily live contact with students, which wasn't happening before, and that some way to track attendance and respond to attendance concerns, which I think is really, really good because there were a lot of people who were very concerned about kids who just weren't heard, no one heard from. And so that piece, but there was no like suspension of anything. It's just kind of like school stopped doing that. With regard to present levels, where you got to at the second part of the question, that stuff needs to start happening immediately for all kids, not just kids with disabilities. We have to figure out where kids are. Curriculum-based assessments to start for sure. Establishing present levels of performance. How did the IEP say that those things were going to be measured? Let's start measuring them that way to start. Then there may be some more evaluation that needs to take place. But so figure out where students are when they come back. And the IEP team should then meet and talk about those things and listen to information provided by the parent. When they say, here's what I saw at home, here's this, I kept this log of all these things where we've seen behavioral regression, where we've seen all kinds of this other regression, to begin to just understand the impacts on students. You can go to the next slide, sorry. And if there is a need for remediation, and it's going to be the rare student that doesn't need remediation, then the IEP team needs to develop a plan to address that. This could be done through additional special education related services in the IEP, could be done through ESY, which again could be the summer or in breaks, or it could be described as compensatory education or something that's not really a concept, but it's emerging as COVID-19 impact services. I think the state's going to end up kind of using those two terms interchangeably, or maybe talking about compensatory education. But essentially, the idea for both would be to put the child in the place they would have been, but for this educational disruption. And, I don't know, it's going to look very different for each child. And that's okay, because what the IDEA requires is an individualized determination. And the US Department of Ed talked about you need an individualized determination, whether and to what extent compensatory services may be needed. So I think I covered that last point there. So, I mentioned this, but some students are going to need a lot. They're going to need circle of wagons, a whole team, just to figure out how to get them back in the door and prepare for their return to the school building. Other students are not going to need much more than what I hope schools are going to be doing for all students. Most kids are going to be somewhere in between. And so whatever the compensatory services look like are going to be based on that individual child's situation. What it's not going to be is you going into a meeting and saying, here are the number of hours of missed instruction. I don't think that I wouldn't advise that as like an appropriate approach. What it needs to be is, here's where the child was in February, where you last assessed, here's our last progress report, and now we've gotten present levels, and we've lost all the progress that we've gained under this whole IEP, and how do we make up that difference? So it's not gonna be an hour for hour math situation where you say, I missed 23 hours of speech, I missed 12 hours of OT, I missed 160 hours of specially designed instruction. It's going to be an individualized discussion about my child now is at this point, and that was a regression of however much, and we need to develop a plan to close that gap again. So Does that help? Carrie, did I end up looping back to all of that question that was our segue?
I think so. I mean,
Okay.
yes, but I would encourage parents to weigh out the difference between compensatory services and what that would mean for their child's interaction with peers if they're requesting that all the services be made up that they missed, being pulled out and having to get many more therapies, and weigh that with the regression that your child has experienced, and where you feel the need is most useful to you. So social emotional learning were impacted as well. And if you're trying to make up, 50 hours of OT, and you've requested that from the school district and they agreed to do that, then your child's going to be pulled out more than not to receive that compensatory service and make up those services. And is that really going to fill the gap for your child, or is that going to make it more difficult for them to receive additional learning they need to receive to this year? So it's up to the parent as to what you want to request. And I would never tell a parent to let it all go, but I would say to look at your child's current present level of performance and create an IEP that addresses those areas of need that have been created, those additional areas of need that have been created by what happened in March through June. And hopefully that'll address the gaps that you are feeling are most needed without maybe sacrificing some of that social emotional interaction that they would get with their peers if you're looking to make up a ton of services. And I think, everybody's using different terminology for this one as well, which is getting quite confusing. So it's working with your local school district and really trying to create that individualized education program based on your child's present level of performance. Which maybe you guys can both speak to about reassessing that present level of performance, and how that will look like in a remote learning or hybrid model, in keeping with the fidelity of the data that school districts are trying to collect, so that we can write IEPs that address the current needs of students.
Yeah, it's going to depend on the skill. And my starting point would be, how is it measured in the IEP? Because hopefully, since if it's measured in the IEP, it says as measured by whatever it is, then we may have data to compare it to. So I would hope we're not just going to start measuring things in totally different ways, because then it's going to be very difficult to compare where we were in February to where we are in September. But there's a larger question about evaluations and fidelity and things that we'll get to, I think, very shortly. But with regard to the kind of initial coming back into school, I think, again, a lot of the ways IEP goals are generally measured is through curriculum-based measures. It's not through standardized, generally kind of standardized assessments administered by a psychologist or, the Woodcock-Johnson or, things that are often done every 3 years because they're supposed to be done, more often. So I think unless there's a real good reason why it's just impossible to do what the IEP says as far as measurement, or if the goal was poorly written and it was never really measurable in the first place, obviously, I would stick with what's in the IEP at first. Plus, I think I would imagine, schools are going to be doing some, whole school kind of curriculum-based measures and just trying to figure out where everybody is. And so making sure that your child gets to participate in all of that, because part of this too is that, a big part of it is ensuring access to the general education curriculum. So you wouldn't want your child to miss out on all of the general education assessment measures that are built in, I hope, to the return to school. Because people have got to figure out, before we start delivering instruction, we need to know where the people that are receiving the instruction are to start. And so hopefully those things are going to be happening whole school, and hopefully kids with disabilities all have access to them. So.
Yeah, I think it's important to, somebody asked about determining whether it's a COVID-19 slide versus a summer slide. I don't think it's important to determine where the regression happened. I think it's just important. And I think that's going to be impossible to identify in our children. I think what's mostly important is that we identify where the regression is and how to address it. And then somebody asked specifically about seniors who are aging out, or students who are aging out. If they have an IEP, again, it's going to be an individualized education program team decision as to whether or not that student will be allowed to stay and receive further education because of the emergency, and because of the loss of education. And that, I mean, that's my understanding, Atlee Ben, of the MDOE guidance, that it can be considered that that child receive further education through public education, and the amount that they would receive would again be determined by the IEP team, but it would be an individualized discussion for each student. And my guess would be is parents and the student are going to have to ask for that, or yes, districts will just age them out. So you should request that if that's something that you would like to be considered, especially as you enter into September. Is that your understanding? Go ahead, Atlee.
Well, there's a few things going on there, right? I mean, there's graduation before you're aged out, and that can only be done through a regular high school diploma. So if a family didn't believe that or thought the graduation, maybe they granted a diploma in May, even though the student didn't receive any instruction in March and April. And so the family could say you didn't meet these diploma standards and challenge that. If a student has aged out, then the family can ask for additional services, or they could say you owe compensatory services and they could be provided. I think DOE, I think you're right, they've signaled that they're going to be flexible with some of that as far as students who are technically have aged out. So I think asking for an IEP meeting to talk about kind of providing those services, meeting the transition needs that weren't able to be met, so that you could support a student's effective transition to post-school activities, employment, independent living, all of that.
I'd say the last scenario might be, I'm not sure what the question originally was now, but the other scenario might be that a student was going into, this is going to be their senior year, let's say 2020, 2021, and the team before this year had not planned on that student spending another year beyond this year. And it might be now that because of the disruption from COVID-19 that student does need another year to have faith. So that's just another, they can certainly decide that. All right, are we moving?
Yep.
Okay, we're still on you. Here you go.
Okay, so evaluation pieces. So some schools I know are saying we've got to delay evaluations under the IDEA until these can be conducted in person. The question is that appropriate? And at this point, I think the answer is no. Evaluation requirements have not changed. There's going to be a significant backlog of these things. I mean, there's going to be students, as we talked about, that have new needs that have risen since March, and you got to evaluate to really identify the contours of those needs. There's going to be students who need really targeted evaluations, like a functional behavioral assessment or an OT evaluation to support a return to school in a very different environment, right? The school that students left in March, even if they're returning to the same school in the same classroom, it's not the same place. So there may be additional sensory needs, there may be additional behavior related needs where a new functional behavioral assessment, is just really required. And I think just go to the next one. There's a couple more. So there's a lot. Schools are going to be under a lot of pressure to get evaluations done because there's a lot of need for evaluations. And in some areas, we didn't have enough evaluators to begin with. That's not an excuse for not doing what the law requires. I'm just kind of outlining that there's a reality here where there's going to be a lot of incentives for schools to delay as long as possible to start the 45-day clock ticking and to give you a consent to evaluate form, because they're not going to have the people to do the thing that the federal law requires them to do. So just want to be clear on that. That is not a reason not to ask for these things. It's not a reason not to insist on them. In fact, it's probably more of a reason if there is a need for additional evaluation to be relatively specific and targeted in your advocacy for that.
So just to be clear, Atlee, you're not saying that schools will not be held to the 45-day rule. That has not been waived. That still applies. What you are saying is you may see some delay tactics and when that 45-day period begins from school districts.
Right. I mean, and people have seen this before, right? Happens a lot in CDS, right? You ask for an evaluation and then you have a meeting way down the road, and then you want to sign a consent to evaluate at that meeting, and you're not presented with one, and then it comes, or you ask where it is, and they say, well, we sent it. I mean, I'm not, I'm just saying that that type of stuff may be happening more, and schools are not going to be real eager to start that clock. So if you really think there's a real specific, clear reason for an evaluation, what I'd suggest is you request an IEP meeting, that you say in your request, one of the things I want to discuss is the 3-year evaluation that was supposed to be done in April, but hasn't been done. And I want to discuss that evaluation. And I am prepared and want to, at that meeting, sign the consent to evaluation form. Just kind of preparing to go into meetings like that. If you don't think you need an evaluation, don't ask for one, because there are going to be a lot of kids who actually do. But if you do need one, I think you're going to have to be pretty prescriptive and targeted in your approach. If we don't have adequate evaluation data, how do we draft an appropriate IEP, right? The other thing I want to mention is, is that there are going to be limitations on how some aspects of evaluations are conducted. There are certain things that cannot be done to kind of the instrument standards in a remote setting. There are certain things that you need to have observations in multiple places. There are ways in which evaluators, I think, are going to feel more limited in what they can do and say, sometimes by districts if they're contracted, and sometimes because of their own practices. What a good evaluation did before COVID was it outlined any sort of areas where there may be some irregularities in how it was done, or I would have liked to get X, Y, and Z, but I couldn't, and here's the reasons. And I think it impacts my evaluation in this way, or because I got the information another way, I don't think it really impacts, and I consider results valid. That's just good practice to lay that stuff out there. And so I expect that you're going to see a lot more disclaimers from the evaluators in these evaluations. And I don't necessarily think that's a bad thing. I think it's indicative of them taking their, standards of the instruments and the things that they're administering seriously. But it's not a reason not to do anything, right? We can't let the perfect be the enemy of the good in this situation. And so a good evaluator is going to be able to get really good information for the IEP team to work with, even though there are these limitations in maybe how the eval can be conducted. So.
Quick question, Atlee. What if you were in the middle of an evaluation time period and that expired during the COVID-19 emergency without it being completed? Does that need to be restarted?
I wouldn't restart anything. I would just kind of say, hi, I'm back now. I understand this was supposed to be complete. Things are, have been difficult. We're prepared to cooperate in any way. Just let us know, and let me know when the IEP meeting is going to be scheduled to review the results. I think just keep in motion with the process that was already started would be the approach. You don't want to reset timelines.
Right. So just continue and try to figure out the number of days that they were at before March and pick up from there. Would that be the best practice?
I mean, to be honest, like for going back in March, April, May, and now, I'm not going to do a lot of day counting, right? I mean, it should have been done already, but there are probably good reasons why it wasn't done. So I think just making clear to the school that you're expecting it to be done as soon as possible, and that you want to know when there's an IEP meeting set. Because the secret about evaluations, right, is none of them get done unless there's an IEP meeting set where they're going to be reviewed. So I would and that's going to be worse now, right? So I would set an IEP meeting to review the evaluation that was underway as soon as you can and as soon as they're able, and then hope that they can get the eval done. I don't know, but going forward, I think it's going to be important to try and hold the line on the evaluation timelines, because it's, there are going to be real limitations, but you don't want to be seen as just like saying, anything goes.
So if
So,
the timeline has expired because of COVID-19, does the school need to justify in writing as to why they weren't able to complete the evaluation within the 45 school days?
I mean, I would, if I was them, I would explain it. But again, I think they're going to be probably excused, even though IDEA wasn't waived. I think schools are going to be excused for all that deadline related stuff from March until the day schools open. But I think that it's reasonable to insist on those timelines being followed going forward. It's not that I mean, it wasn't waived, so it was still the law. But is it reasonable to say, the evaluation should have been done already, you're in violation? I mean, you could file that complaint. I'm probably not going to do it for you, though. So.
So just sort of circling back a little bit to FAPE in a hybrid form, if on an IEP, so we've heard about Section 6 about the IEP where school districts are being encouraged now to create plans for an IEP under a hybrid model and a remote learning model, and what the services, accommodations, and modifications will look like under those models. And that might be adapted amounts of times for therapies, as well as specially designed instruction. That being said, that just came out last week, so I would be astonished if any school district has moved forward with designing those, that part of the IEP as of yet. So the IEP that's in existence for all students is probably going to be based on an in-person learning model. And so are schools required in a hybrid form to meet all of those minutes that are currently on that model in all PT, OT, and speech therapy minutes, as well as in-person instruction? If the kid is only going to school 2 days a week?
That's the IEP. So again, my position is they need to implement it unless and until they have a meeting and they go through the typical IEP process to change it. And I don't know if that's going to be how things get interpreted, but I don't know if I'm advising a parent, I don't know how else you would advise them. Like, no, like insist on your current IEP until they have a meeting with you to change it. Now, do I think that's going to happen across the state right away? No, I don't. But that's the position. And again, schools, it's not fair for a school to expect you to just say, okay, fine, whatever you want to do. The IEP process is built on working to achieve consensus and work toward consensus. And the world has changed, but the law hasn't. And if the school has failed to bring you into that process, it's not your fault that you're chafing against it. And if they're trying to say that all of a sudden it used to be 3 hours a week of related services was necessary for FAPE, but now it's 15 minutes, and they're not going to discuss that with you at a meeting, then I think you are right to insist on the implementation of your old IEP while they defend that unilateral change. But I do really want to underscore that I think it's important for families to work with schools and to work with them collaboratively and not be, it takes two kind of to come to the table and work through what should be a cooperative IEP process. So am I advising you to, insist on every single minute of your IEP, like no matter what the school does? Like, no. But if the school doesn't respect your involvement enough to hold a meeting when they're trying to reduce a significant amount of services and at least discuss it and explain why they think their proposal is going to provide FAPE to your child, then yes, I think your default position should be, until you involve me in this process and follow the law, then do what my IEP says.
So what about one-to-one support? A couple questions. How do you address one-to-one support in a social distancing? And also, if a child gets one-to-one support on their IEP and they're 100% remote, shouldn't they be able to get that one-to-one support virtually as well for the same amount of time?
Yeah, so the virtual thing, I think we covered this, but it's if they need one-to-one support to access virtual instruction, then like, is this a school, are you imagining a school that's all remote, there's no students in school? Is that what you're saying?
What I'm saying is, if the child is hybrid or 100% remote, shouldn't they have the right to receive the same amount of one-to-one support virtually that they were receiving in person?
What they have a right to is the services they need to receive a FAPE. So if you're going to have an IEP meeting and make some changes, then there should be some discussions about what they need. And if they need a one-on-one in person, it's hard for me to believe they wouldn't need one-to-one support virtually. But we're going to get into that problem that we talked about before about sending people into the home. So if it's a hybrid model, I think my inclination would be to make that request for, okay, we're doing the hybrid model, but they still need that one-to-one to access the remote. So the other kids in their cohort may be at home, but they're still at school getting that one-to-one instruction, but they're maybe accessing it through this sort of medium. You know, I don't know. This is new to everybody. I don't know how it's going to shake out. Does that help?
Yeah, I mean, I think it's hard because, if like physical therapy is really hard to do virtually. We've been attempting to do it in our house. And if you don't have the equipment in your home, it's really hard to do. And if a school's saying we're only doing therapies virtually and the child can't access that, then I think, like you said, Atlee, it's your right to follow the IEP process and demand that the IEP is carried out with in-person therapy. I think therapies are really, some speech therapy might be a little bit easier to do virtually. PT's been difficult and I have a really high functioning child. OT has been sort of in the middle, and I think it depends on the child. And if a child hasn't been able to access anything virtually, then I think, like you're saying, it's your right to follow through on the IEP process and, the complaint and the mediation and the due process, procedural safeguards that you have to demand that you get those in-person services if you feel your child needs them. How that's going to be ruled, Atlee and myself and Ben can't answer that question because we've never been in this scenario before. So it could be a reasonable request of you as a parent, but how a complaint investigator or a due processing hearing officer is going to rule on it, we can't answer that question.
And it's all going to be individualized because that's what the I in IEP stands for. And so there were some students who got really great specially designed instruction in reading at the end of last year, and that was remote. And so it's not reasonable for maybe if the school's still in a remote model, because they weren't harmed by it, they could receive FAPE that way, then, in-person instruction doesn't matter. But if a child was not receiving any benefit from that instruction, if physical therapy, everybody agrees, you're not receiving the benefit of this thing that we've determined is necessary for you to access your education, then yes, the IEP team needs to determine how that can be delivered in person safely. Failing that, they're going to need to determine if, for the reason that it's, for the time period that it's not being provided still, what they're going to do to fix that. But I think that's the fallback option. I think you want to solve this problem going forward because everybody needs to operate under the belief that this is our reality for this school year. If anybody's thinking about, well, we're going to get to November, or hopefully we've all been kind of like, we've pushed that type of thinking. That's how we got to August, because we had that type of thinking from March until July, through July. But people should be planning, and IEP teams should be planning for this to last, for this the IEP that you're drafting. And then hopefully that's not true. And hopefully these public health restrictions can be lifted and the dangers are lessened by developments that may happen later in the year. But right now, it's not reasonable for anybody to plan on the world looking different than it does today anytime during this school year. That's kind of my belief for planning.
We have a question about specialized 28 services and being billed for school hours. If you have specialized 28, which is in-home and community-based supports, and this isn't Atlee and Ben's specialty, so I can address this question, but what I would advise you doing, because these are Maine Care rules, and I know Maine Care is addressing these rules, and I think it's been adjusted so that they are able to work with children to do some schoolwork. Trista Collins is the Maine Care Educational Liaison for the state of Maine. And I would refer you to Trista Collins, and I will put up her email address in the chat box. And Dylan, you can add that to the chat box on Facebook. And she would be, I have a relationship with Trista. I know she would be more than happy to help you address those questions as far as Specialized 28 and working at home if you have a BHP with your child on schoolwork.
Okay. I mentioned this. I do just want to underscore it, and this is the last slide, so we can take a few more questions. But I know everybody's been at this a while, so there are other laws. Section 504 also has a FAPE requirement. Section 504 of the Rehabilitation Act. I think a lot of the same things that we've been talking about would apply. One of the things about Section 504 is that the procedural safeguards are much lower. It's much less prescriptive, but the anti-discrimination and right to free and appropriate public education is clear. It's just there's a lot less clarity around, you know, timelines and meetings and things like that. Also, the Americans with Disabilities Act, as I mentioned, and the Maine Human Rights Act and Section 504 prevent schools from discriminating against children with disabilities. And they all require that schools ensure students with disabilities have equal opportunity to participate in and benefit from programs and activities. So those sorts of things could come into play, especially as like some of the things I heard in chat that were, or saw in chat that were disturbing about students being separated out here. When schools start to open up their programs and activities to anyone, they need to ensure that they're open to everyone. And as the year goes by, there could be some difficulties there. So, with that, we've been at it 2 hours. I'm happy to stay on and answer some more questions, Carrie. I'm sure Ben is too. It's your show. Let us know.
Okay, I'm going to go through some of the questions, but while I'm doing that, I'm also going to launch our poll. We are nonprofit grant funded, and so getting poll results for both Disability Rights Maine and Maine Parent Federation helps us to bring the data in that we need to bring in order to maintain our funding and show that we're assisting individuals. So if you could please take a couple minutes just to fill out those 8 questions, that would be great. Do the students who have Monday classes canceled by the 4 holidays throughout the school year need to be made up? I actually thought of that question myself. Because we're in hybrid model, if kids are going to class in the cohort Monday and Tuesday, Monday holidays, they're going to miss more classes. If they have an IEP, is that something that you could request for that time to be made up? Or perhaps what I would do if my child had an IEP would be to ask for the Thursday, Friday cohort. That's probably one of the easier fixes if you're able to do that. But is there any, I mean, it's a federal holiday. I don't know. Is there any legs to stand on with that, Ben or Atlee?
I don't know. I'd say if that's your biggest problem this year, you're doing a good job, unfortunately.
But at the end of the day, I mean, the team should talk about whether that kiddo needs those extra 4 days. Maybe that's an ESY approach and say, okay, during those breaks, we're going to have 4 days extra, something.
I think it was answered about the shortened school year. Right now, there has not been a waiver by the governor for a shortened school year this year. It's still 175 school days. If a school is in a hybrid model, but a parent is willing to transport their child, should the district block some time for that child to receive some in-person support on the days that they weren't hybrid? So let's say a school district is doing the Monday, Tuesday, Thursday, Friday. A parent's willing to transport their child on Thursday and Friday. Should the school allow that to happen?
If it's necessary to provide them a FAPE, then
Okay.
But the IEP team should discuss it and develop a plan.
What about children who are in resource rooms for educational purposes? Should they be allowed to join their typically developing peers for specials if those are occurring?
So the IEP, the LRE is the same in the IEP. So if they were doing that before, it should happen again. Now, the cohort model is going to create, or pod model, or whatever schools are calling it, is going to create problems with that, because my understanding of how most schools are going to do it is they're going to send teachers, they're going to keep students in one place and send teachers, adults around, or at least that's the thinking. It needs to happen. And so schools need to think, I mean, a school shouldn't have just a resource room pod, right? So that's the problem, is the premise kind of the question. But I know that that's happening. If a child was having those experiences before, they should continue having those experiences. And it's going to be on the school to figure out how that's going to happen. And I don't think that you should accept, at least initially, a school creating a situation where they're segregating kids unnecessarily and then using their decision to segregate kids in their public health arguments about why those kids then can't experience art and music and PE with their peers, right? And so then the alternative of like having them dial in remotely to a class that's happening next door, we're already on the wrong problem. The problem was the initial decision to create segregated pods. Those are things that we're interested in hearing about if those things are happening, and asserting your rights early and raising concerns early is going to be better than undoing it later, in my view.
Can I ask for compensatory education over school vacation?
So how compensatory services are delivered is often worked out through the IEP process or through kind of negotiation outside of that. And so over vacations and over summer is often how it's delivered, for the reasons you said earlier, Carrie, about, you should be developing an appropriate IEP now, which probably won't leave a whole lot of room in the day for services. So a lot of times the compensatory education's really most appropriately delivered, usually over the summer, but sometimes school vacations, I've seen that happen. Yeah. You can ask for anything. You can ask for anything. Whether the school has to give it to you is another question, but it should go through the IEP process. And if they say no, they should explain why in a written notice. And then you can decide whether you want to challenge that or not.
504 plans have not been changed. There are no waivers for under the ADA for 504, correct?
Correct.
Do we need to find ways to better support funding for our schools so they can better help us? I will tell you this, the governor of Maine has directed every single department within her governorship or under her, in her administration to come up with a plan for 10% reduction of funding for next year, including the Maine Department of Education. So that's where the funding model stands. If you were watching school committee or school board meetings, worried about the impact that COVID-19 would have on your funding for this year, wait for next year because it's going to be worse. So that's going to be a hurdle. Funding for schools next year is going to be a major hurdle. So if you want to assist your school district, feel free to go for it. But yes, that's going to be a hurdle. What are the guidelines for the resource room model? Can the child go to the resource room for instruction and then be in two different settings safely?
I don't know. I don't know how schools are going to do that. There's nothing in the DOE guidelines that would require schools to only have kids in one cohort, right? So, but there's also nothing to require schools to deliver services in a resource room model. They could instead push those specially designed instruction into the classroom. So I don't know, this is like we identified, I think we've covered this ground a little bit, but this is gonna be one of the sticking points, I think, with schools using the pod thing and making bad choices kind of initially and not really fully understanding the repercussions of those. And then using public safety kind of to justify those. But really, if we just step back, we could probably do it better and avoid a lot of these, what seem clear to us, likely unintended consequences of approaches of creating segregated pods so that kids can access SDI.
And I would also warn parents, and this is just my looking into the future, and one of the reasons why I'm steering clear from the 4-day in-person model for my daughter. I understand your needs for in-person learning, and I also understand your needs to keep your child safe, and that's a very personal decision. And if you choose for your child to be in that model, that is absolutely your choice, and I respect that 1,000%. But in looking forward, once you do put your child within that model, that's going to become your child's least restrictive environment. And it may be difficult as we come out of this emergency at some point in time to make the argument that your child should be out of a resource room and back in a mainstream population. It may be very difficult to argue that that's no longer your child's least restrictive environment. So just keep that in the back of your mind as you make these decisions for your children. I had a question about if a child gets sick, and I'm going to add this in, if a child's forced to quarantine because a member of their pod gets sick and they miss a physical therapy, or they miss part of their IEP because now they're being forced to stay at home, are they entitled to get services made up for that missed time?
Again, if it's going to be necessary to allow them to continue to receive a FAPE, I think that's an exact example, though, of why the IEP team should do the contingency planning that Ben talked about, and that I think the department's pushing, is that you have really the contingency plan I think they should have is for if a school goes to red, or there's exactly what you just talked about, a quarantining situation. So if we have a legitimate public health and safety reason why we're all going to go for 21 days or whatever into a quarantine, the IEP team has already planned for what that means. And so you just have these conversations. I don't know the answer to that. It's going to be specific to that child. So the conversation would be, what happens if my child misses 3 weeks of PT? What's the impact on them? How are we going to address that? Or what happens if we go to full remote? What kind of supports are they going to need to access their education? So doing that contingency planning, because that's going to happen. Like that exact scenario is going to happen. I hope it doesn't happen very much. But it's definitely going to happen in classrooms across. It's happened already everywhere where kids have gone back to school. You're going to have that situation. So planning for it at your next IEP meeting and being real clear and specific about what will happen, that will reduce the workload on everybody going forward, because then you've used this meeting to plan for that contingency. If it's short and everybody comes back and starts implementing the agreed upon non-contingency IEP within a few weeks, then everybody just moves on. So I think it's a good reason to do that planning, but there's no clear answers to those specific questions because it's kid specific.
What about schools being able to meet the CDC state guidelines for social distancing, as some districts may have restrictions to being able to keep students and staff safe? I think that's what we're seeing right now. You're seeing every single district come out with a different plan based on those guidelines. And so the variants and the models are mind-numbing. But I don't know if Ben or Atlee, you have anything to add to that?
No, I think there's no way around the health and safety requirements from the state, so they can deliver those in many ways.
So we've probably answered this question, but just to reiterate, are schools legally allowed to deny my child the full services of their IEP during the pandemic? And if not, how do I pursue action against them? No, they're not. There's nothing that's been waived in IDEA. So we have talked about working up the chain of command. I'll also add that Maine Parent Federation, so Ben and Atlee are the only two school lawyers for Disability Rights Maine for the entire state of Maine. So they're not available for every single case or IEP meeting here in the state of Maine. But Maine Parent Federation does have what we call the Family Support Navigator Program, where we can offer peer-to-peer assistance. Ariel, I would encourage you to call our offices, and we might be able to walk you through the process of working up the chain of command and accessing your rights for this specific question that you have. We can work one-on-one with you. And if we identify that there's a case that has egregiously violated the rights of parents and families, I'll contact Ben and Atlee, and they're very generous with their time, and they'll usually provide me an answer the same day that I can get back to you with. They just don't have the availability to provide the one-on-one support like Maine Parent Federation does, which is why it's awesome that they're able to join us today and answer some of these questions and put this webinar on. but it's also why we exist. So I would encourage you, Ariel, to contact our offices and we can get you connected and provide you that one-to-one support that you need. And I'm very comfortable navigating the question that you asked.
Can I saw a question come in through the chat. I think it was all panelists that I think kind of wraps things up. So I'd like to answer that and then probably wrap things up, unless you think there are others that haven't been addressed. Did you have others on your list?
Why don't you answer that and I'll look through. I think I've been going through and we've pretty much answered a lot of what has been asked. So
because this person said our district is choosing which special education students are allowed 4 days per week. Are we allowed to know the criteria they are choosing these students? Yes, because the only defensible criteria would be through an IEP team process, deciding what students individually need. And so this is an example, I think, of this is what's happening across the state, is that schools are determining based on how many parents said they'd like in-person instruction and how many staff they think are going to show up for school, what they're going to offer, and they're working backwards from that. And so it's just really problematic as an approach. And so, yes, of course, you need to know the criteria for choosing which student gets special education service or access to 4 days a week, because you need to be involved in that through the IEP process and determining if that's the level of service that your child needs to receive a FAPE. So I don't know if they do need 4 days a week, but I do know that you have to be at the table, and there should be a process for determining what they need to receive a free and appropriate public education. So I think that kind of like wrapped up some of the themes that we've been focusing on, and it kind of highlights my biggest concern and what's going to frustrate a lot of parents is it's just going to be clear to everybody that there was this backwards approach and that their kids are just being fit into a couple boxes. And that's not a legally defensible approach when the law requires these individualized determinations. So.
We have a question about Maine Parent Federation helping with Section 28. Yeah, Maine Parent Federation is federally funded to help you navigate systems of care for state services, the medical world, school systems, and mental health. And if you call us and we can't provide you with direct assistance, we will find you the resource that can provide you with that direct assistance. So do not hesitate to pick up the phone and ask the question, and we will work with you to find the answer one way or another. There's a lot of, and I know we sort of addressed it, but can you, I've got a couple questions about being able to provide the one-to-one support for a child who needs like the hand over hand or the functional life skills that need to be addressed, but because of the social distancing requirements that are in place, it's my understanding that the individuals that are providing one-to-one services to children are going to be fully equipped in the PPE they need to be equipped in so that they don't have to maintain that 6 foot or 3 foot distancing. Is it that your understanding as well?
Yes.
Yeah.
If the child needs hand over hand, then the person that's providing that, I would assume, is going to insist on, and their employer is going to need to provide adequate PPE that would probably be more akin to what medical professionals are going to be providing, or if staff are coming into contact with, because they're working on skills that involve coming into contact with bodily fluids and other things, then yes, they're going to need to equip their staff to work on those things. It is not okay to just say we're no longer working on these really basic foundational skills. We just have to figure out how to do it safely. And so I think that schools, I think the department is trying to obtain that equipment. But there's going to be staff who are going to say, no, I can't do that. And schools are going to have to find other staff, but we can't just say for some unknown period of time, we're not going to even work on these 6 skills identified by the IEP. Schools can say that. I just don't know that that's going to be defensible. So I don't know, Ben, do you have anything to add to that piece? Or?
No, I mean, it goes back to the, can you request in-person services? Yes. I mean, if that's what kiddo needs. So it's insist on it.
So Nicole asked if that would apply to OT. Yes, it would apply to all therapies, Nicole, as well. There were a ton of questions. I tried to group them into themes and generalize them as best I could. But if you asked a specific question and you don't feel like it was addressed, I'm going to put my email in the chat box, and I would encourage you to please email that question to me. And if I don't feel like I can answer it with the resources and staff I have on hand, I will connect with Ben and Atlee and see if I can get a quick answer from them as well. So I do want to make sure that your need has been met. And I found it extremely challenging to make sure I was keeping track of all the questions, but I knew that would be the case today. So I do apologize if I missed your question. Please email it to me, and we'll make sure that we get an answer. I thank you so much, Ben and Atlee, for your generous amount of time today. Thank you for all of you participating today. I know it's an extremely challenging time. Maine Parent Federation is here for you. We're answering our phones live. We're in the offices. We're not doing any in-person trainings, but everything is virtual, and we're meeting the needs of you virtually as best we can. And that means that we can attend IEP meetings with you if that's where you feel you need support. So please pick up the phone, give us a call. We'll get you connected. You know, our motto is if we don't have the answer, we're going to help you find the answer. So we promise we won't lead you to another closed door.
Oh, sorry.
We're all parents of children who have disabilities, so we have that lived experience, and I'm going through it just like you guys are, so please use us. Go ahead, Atlee.
Yeah, I was just going to say thank you for having us, and that the guidance that we went through today is on our website. There's also an online intake form, so you can fill that out without having to wait for a telephone appointment on these issues. We are happy to help, happy to be a resource, and thank you for getting so many people together. Maybe next time we'll have some more clear answers, but I think this is going to be a great year.
Yeah, I would agree. Just one last note, we did record this on Facebook Live, and it will be, as soon as we end this webinar, it'll be up on our Facebook page recorded. And by the end of this week, we will also get it up on our webpage. And so if you just go to mpf.org, our online trainings, we'll have it up there as well, so that you'll be able to access it multiple different ways. I want to thank our ASL interpreters as well for your time. This could not have been easy to interpret today. So thank you so much. I hope you all have a wonderful rest of your day. Thank you for joining us, and we will hopefully see and hear from you soon.
Thanks, everybody.
Bye.